Well, Hal, once again, it's a real pleasure to have a conversation with you, this time about the health plans. And one of the things that we've decided that it was very free-flowing, that we should try to make a summary of this, and this you have done. So I think we should get going on the summary.
Fine. Well, anticipating this, I did prepare one. So I'll talk very briefly about it. 3 parts. First, there are 2 halves to the healthcare system, the financial half and the half of provision of care. These 2 halves interrelate with one another very closely. The financial half determines access to care, and the provision half determines the type of care that we get. Each influences the other. So poor finances limit the type of care people can get, and inappropriate care wastes finances. The second major heading of what we covered were the 3 types of proposals that are emerging in the political debate about health care. The first one is continue the present system of private health insurance. That's the system that brought us today's crisis. But continuing it is the position largely of the Republican candidates who believe that it represents financial or market justice in that individuals get what they put into the system, and society does not have a role in assuring health care or health for all. The opposite side of that is government health insurance, in which everybody is insured by the government to obtain health care, such as through an extension of Medicare to everyone. This is an insurance proposal called single payer in many circles. It is not a health care program run by the government. It's an insurance program. The provision side of it remains private under the control of professionals. The third form is what we're experiencing today in the election campaigns about health care, namely a position in between the 2 in which government regulates private industry but leaves it functioning and provides an alternative government plan for those who cannot afford private insurance. And that's the position, in one way or another, that's advocated by Clinton and by Obama. The problem is that none of the proposals that's been brought forward adequately solves the crisis of cost. They do not have adequate ways to reduce the ever-rising cost of health care. An effective cost control is going to require limiting private insurance waste and profiteering and redesigning the health care for chronic disease, which consumes 80% of our expenditures. The last part of our discussions had to do with what people can do about the health care crisis, and I would say 2 things. Number 1, know where your representative stands in these different proposals. And number 2, wherever that representative stands, insist that they themselves work for universal insurance and cost control simultaneously.
Well, Hal, I think this is an excellent summary of where we are. And I hope that everyone will take it to heart, try to apply it, and work with somebody's concept of a universal health plan to see if we can really improve the health situation in the United States.
Right. We know how to do it, so the question is the will.
That's right.